Hey everyone, welcome to Tooth Corner. Today we're chatting with Dr. D about all things braces and smiles. Let's dive in.
Hello, my name is Dr. Shahram Daneshdost. I am a certified orthodontist from the Faculty of Dentistry, University of Toronto. I've been practicing in Canada since 2013.
So, Dr. D, let's start simple. What exactly is orthodontics?
Orthodontic treatment is a part of dentistry which is dealing with the arrangement of the teeth, chewing, aesthetic of the smile, and also changing the arrangement of the bones, upper and lower jaw in three-dimensional, horizontal, transverse, and vertical during the time that patient has growth potential, which is mostly during their peak of the growth spurts.
That's really helpful, Dr. D. So when should someone actually start orthodontic treatment? Is there a right age?
Starting the orthodontic treatment depends on the problem that the patient has. Some of the problems, like if the upper jaw is a little deficient and slow in growth, in those cases, which will cause underbite, we might need to start the treatment and control of the growth as early as age 5 or 6. Some of the crossbites, which means again like the top teeth are behind the bottom teeth, some of them can be problematic and they should be treated as soon as possible. Otherwise, the teeth will abrade each other and they will cause aesthetic damage lifetime. But some of the treatments, like if the teeth are just crowded but the development is normal or the arrangement of the upper and lower bones are okay, we will wait until all the teeth are permanent. I'm not talking about wisdom teeth. I'm talking about all the teeth except wisdom teeth, which can be around age 12, 13. Also, whenever the patient is mentally accepting and like they understand that it's an expensive treatment and they feel responsible to cooperate with the orthodontist.
Okay, Dr. D, how long does orthodontic treatment usually take?
The length of the orthodontic treatment again depends on the problem that we are facing. In some patients, we have to, the problem starts to show itself in the primary dentition. We need to intercept with some appliances that are called functional appliances. We have to control the direction of the growth. Sometimes some permanent teeth, they are trying to erupt, but they don't have room. So we have to regain room and make room for them, which means we have to start the treatment when patient is still in mixed dentition period and before 12. And then we have to continue the treatment through the permanent dentition and do the standard braces. So it can be as long as 3 years. Sometimes the patient's problem is minor and it's just a minor irregularity, and it can be as short as 6 months or 9 months. So again, depends on the problem. The treatment can be 3 to 4 years, as short as 6 months.
That's interesting. So are braces the only solution, or are there other options too?
When we are talking about orthodontic treatment, the first thing that many people like to name it, and many patients, they just come and say, yeah, I'm here for braces. But orthodontic treatment is just more than braces. As I mentioned, some problems start to show themselves before the permanent dentition, when all the teeth are permanent. We have to consider functional appliances, some removable appliances. They are also part of the orthodontic treatment. And these days, braces are not the only option to move the teeth orthodontically to their correct places and make the bite normal. There are also clear braces, which can be ceramic or plastic. They are less visible, but not 100%, because still the wire on the brackets are thin silver line and it's visible. There is also another option, which is Invisalign. Invisaligns are the trays that they are clear, and the patient is supposed to use them most of the time close to 24/7. And every 6 weeks for their appointment, they will come back and the dentist, orthodontist will provide them with the new ones. And they will gradually move the teeth toward the places that are planned. I have a model here which shows the old-fashioned braces, metal braces. Like I like to call it standard way of moving the teeth and correcting them. As you can see, the elements are the metal attachments, which are called brackets or braces. They will be bonded or cemented to the teeth one by one, and then the wire will be inserted on top of them and will be tied. And every time we change the wire and these donuts, sometimes instead of these single ones, we can use the power chains. Power chains are the same material. They are silicone based, and as you can see, they are stretchable. So these holes, one by one, they will go on each bracket and we have to stretch them. And when they are moving back to their normal length, they will move the teeth with them. And this is one of the ways to close the spaces that we have between the teeth. So with the single ties, we can just align and make the position of each tooth individually. And then to close the spaces or move them around, we have to use these power chains.
That's great. One last question. Is orthodontics only for children, or can adults get amazing results as well?
One of the very common questions, and I can say misunderstandings about orthodontic treatment, is that many still think that braces are only for the kids. I have so many adult people, they come to me and they say, yeah, I think I'm too old for braces. There is not such a thing to like pick a candidate for braces. As long as there is enough bone support and the gum and the bone around the root is normal and patient doesn't have any systemic problem which will affect the quality of the bone, the teeth can be moved by braces or Invisalign or any other thing, any other orthodontic appliances. So there is no age limit. Age is not a factor in deciding who can get braces or not. The only thing that age matters is when we want to use the growth of the patient to control the position of the bone and the jaws.
All right, time for the fun part. Dr. D is showing us some of the cool stuff used in orthodontic treatments.
Here I'd like to introduce some of the materials and appliances that we as orthodontists use daily to do the adjustments on patients. These are the brackets that we bond them one by one on the teeth. We use the same filling material which is called composite resin to use them. Many patients are concerned that, is it toxic or is it, but it's like the same filling material. And whatever we put in patient's mouth, it's 100% FDA approved. This colorful power chain. Many patients, they just think it's just for beauty, and that's one of the problems we have, that sometimes patients, they really love braces. We use these power chains, different colors every time that patient comes. And we use some instruments. They are mostly pliers. Like we have a cutter, we just need something. It's like a small scissor. We need to cut these products, the amount that we need. And then we have some instruments which we call them Matthew. With these pliers, we hold these rubbers and we carry them to the mouth and we put them around the brackets to do their job. The other thing that many of the patients like a lot are these elastics. These are a bag of 100 rubber bands that sometimes we have to hook them daily and over the night. We ask the patient, we teach them how to do that, and it's very easy. They just need to stretch these rubbers and they will hook it on the brackets, and they will also help us to move the teeth and correct the overbite and give the patient a better bite. And fortunately, teenagers, they love braces, and sometimes they call with their colors from the internet and they say, yeah, buy this color for me, I want that. And so it's kind of, these days, orthodontic treatment is really fun. And when I see the patient is happy, I also get the good energy from them. And I try to keep them happy, and then happy patient, happy kids, happy parents. And most of the time, I've learned how to make it fun, the orthodontic treatment, both for the patient and for the parents.
Big thanks to Dr. D for all the great info. If you're thinking about getting braces or aligners, come visit Tooth Corner. Our team would love to help you get the smile you've always wanted.